Good evening, everyone. Welcome to the another artist talk at the seventh edition of the Indian Photo Festival. We have been listening to some of the phenomenal photographers and artists in the past few days, and we have another interesting photographer who is based out of Hyderabad. Today with us, we're going to talk about his work. It's none other than Harsha Vadlamani, and he's very familiar to all of us. Uh, I would like to give a short brief about Harsha. Harsha Vadlamani is an independent photojournalist whose work focuses on rural distress, migration, health, and the environment across India. His work has appeared in National Geographic, the New York Times Magazine, the Wall Street Journal, Geo, Al Jazeera, Lemo, and Financial Times Magazine, among other publications. He was most recently awarded a COVID-19 emergency fund for journalists grant by the National Geographic Society. And Harsha will be talking about this work this evening with you all. You can look up more of Harsha's work at his website at www.sriharsha.in. Thank you, everyone. And I'm handing over to you, Harsha. All the best.
Thank you, Akin, for the introduction and also this opportunity. Let me figure out how to share my screen. So when the second wave of the pandemic happened, like everyone else, I too was really worried. And the visuals that were coming from Delhi, Bombay, and other places, they were not easy to look at. And what really concerned me was the news that came in of the virus spreading to villages. And that really concerned me because I've been reporting from rural India for about 13 years. And I know the health systems there, they're not equipped to handle a pandemic of these proportions. So I thought I should travel in rural India and look at what's happening, especially because there was no report that was happening from the villages. We were only reading reports of like, okay, the village, we are reading about the numbers, how many people got infected in a certain district in Uttar Pradesh or Chhattisgarh. But at the time, I don't think anyone was really reporting about what was happening in the villages. There was not a lot of reporting, especially at the national media level. So I planned to set out and visit rural India and see what was happening there, how bad the virus situation was. But also at the same time, I was thinking of other ways of reporting on this pandemic, not like straightforward, hanging out outside of hospitals and reporting on the scenarios there. But and it was at the time that I remembered a story on a hospital in Chhattisgarh that I read many years ago. This was a hospital close to a place called Bilaspur in Chhattisgarh, a small village called Ganiyari. And here in the year 2000, a group of doctors, young ones from AIMS, Delhi, they set up a hospital that today caters to about 15 lakh people across 2,500 villages. And most of these villages, they happen to be in and around two tiger reserves, the Achanakumar and the Amarkantak, very interior areas with largely indigenous Adivasi populations. I thought this would be a good way to look at the virus, like all these doctors who have been struggling against odds in low resource settings for many years. How are they dealing with the pandemic? What unique strategies are they employing to control the pandemic? So I started from Hyderabad, and the image you're looking at here is the first image that I made on this trip. It was at a coronavirus checkpoint on the Telangana-Maharashtra border. And these are the barricades that they put up. So here's Jan Swasthya Sahyog, or JSS, slightly to the north of Raipur. And it's the Achanamar Tiger Reserve here. The villages, they're really spread out, hard to access, especially during the monsoons, because the streams and rivers will be in spate. And by the time I reached these villages, there was already a widespread panic. People they don't want anyone to enter their villages, so they set up all kinds of barricades. Every village became an isolation zone in itself. And this was a inter-district checkpoint between Bilaspur and Mungeli. And so when I reached there, I was told about how there was intense resistance to getting tested. The villagers, they did not want to get tested. They did not want to get tested. They're like, okay, these are symptoms that we have every year. Every monsoon, we have cough, cold, and fever. Now you're coming and telling us that this is COVID, and you're branding us. Now nobody wants to come and talk to us. Nobody meets us. Everybody keeps a distance. We're not being allowed to meet anyone. So we won't get tested. This was a man that I met on the first day there. Ashwini Sahu, he's had symptoms for 8 days. And this is the third health center that he visited in all this year, in as many days, trying to get tested. And health center staff told him that they can't test him because I asked him why. I asked the staff why. And they said, because vaccination is going on and we're all busy with vaccination. So I asked him, okay, how's the vaccination going on? They said, oh, there are no vaccines. Some sort of situation in the villages, I guess. And this was at another health center that I visited. This was a small batch of 19 people that they tested, rampant antigens, and 12 of them tested positive. So JSS, it's a small hospital with limited capacities, and they realize they cannot handle the caseload if the virus spreads further in the villages. What they did was they deployed their health workers. JSS happens to run a village health program in 72 villages, most of them remote villages with Adivasi populations. And they have 2 village health workers in every village. What these health workers do in regular times is to monitor and check the health of pregnant women and new mothers, the weight and nutrition of newborns and children, and distribute stuff like chlorine tablets, etc. But when the virus spread, these women, they volunteered to also take up the pandemic responsibility, the coronavirus control responsibility. They said, these are our communities and we're going to save them. This is Kalabai Maravi, one such health worker who's employed by JSS in a village called Bamani, deep inside the Achanakma Tiger Reserve. So what Kalabai and other women like her do is they walk door to door, check the villagers for symptoms. They check their SpO2, they ask if they have fever, cough, cold, and other symptoms. That's a chart that the organization made for these health workers because a lot of them are illiterate, and it makes the job easy to have pictorial representation of each symbol, of each symptom. So they walk door to door, tick symptoms, and this is the most ingenious thing that they've devised. Because a lot of villagers, they do not want to get tested. They ask anyone with common symptoms, they would ask the women, ask the villagers to smell a soap. So if you have cough, cold, fever, body pains, and other common symptoms, and if you're unable to smell a soap, they'll say, okay, please consider yourself to be COVID positive. This is what you need to do. You need to isolate yourself, and these are the medicines, and they give them medicines for 30 rupees. That's it. And to control the virus at the village level, a lot of them. I think in 2 months, they monitored over 3,000 people, and what 30 of them passed away, but the rest, they could be saved, all because of the efforts of these community health workers. And one day I was with a health worker. They've been telling me a lot of stories about how the villagers, they were not willing to get tested or like chasing them away if they go with vaccines. And I was sitting with the health worker in front of someone's house, and I heard a drum beat in a distance. And I was really curious. I asked what was happening. And the health worker said, oh, there's been a death in the village, and I guess the family is doing some rituals. I asked if we could go. We reached the place, and I was just shooting these men taking a bath in the pond. And suddenly they noticed the health worker who was with me. They started yelling at her. They thought she was there to give them vaccines. They started chasing her. Uh, they asked her to leave. They were yelling at her. I couldn't take pictures of all that because I was trying to, tell them that she was not there to vaccinate them, but she was just helping me. And this is back at the hospital, a patient who was just brought in. And this is a woman in one of the villages that we traveled to. The family, she had all the symptoms of the virus, but the family was not willing to take her to a hospital. Their reasoning was the woman was already old. It's a mother, but she's old and it's her time to go. The staff, they tried to convince the family. And the family, in fact, brought the lady to the hospital in the evening, 70 kilometers away. But the doctors told her, and they asked what the condition of the woman was like. They said it's serious. They're like, okay, we're going to take her home. Here, the woman passed away some 3 days later. And this is inside the COVID ward. This is a patient getting his X-ray done. So that is a patient, Arjun Jagat. His condition was really bad. His lungs were seriously damaged. So he was being moved to a hospital in Raipur, the state capital. And this was a 2-month-old baby with COVID. And I think it's arthritis in his knees. The doctors are doing a surgery on him. And this was a patient who was critically ill, and the family wanted to take him home. And this was another curious thing that I found in the villages, in these parts, that unlike in the cities, doctors were willing to let the patients be taken home if they were really serious because they understand the local sentiments and they just had to give in or be more understanding of their own sentiments in the villages. Patient being moved to his home. More on this later, actually. And this is a nurse, the COVID ward. So while at JSS, I heard about a group of young doctors in a place called Ambikapur. The organization was called Sangwari. They entered into an MOU with the government hospital there, and they took over the COVID ICU. I found it pretty interesting because government hospitals do not usually let private doctors take over their COVID, operate in the premises, let alone take up the responsibilities of the COVID-19 ICU. So I wanted to see what was happening there, how the arrangement was working. So I traveled to Ambikapur. It's in a place called Sarguja. The district is called Sarguja. It borders Jharkhand and Uttar Pradesh and Madhya Pradesh. I traveled to this. And this is Dr. Yogesh Jain. Dr. Jain was one of the co-founders of JSS. And he left JSS and joined Sangwari later. This is a woman, Rajinta Topo, an Adivasi woman who just tested positive for the virus in a weekly clinic. They run a weekly clinic. This was Dr. Jain advising Rajinta about what precautions she needs to take. And this was at the Government Medical College Hospital. A prisoner was brought in from the district jail with COVID-19 symptoms, but they had to be careful, so they shackled him to the bed. And there was a policeman standing outside. Again, so another interesting thing, like patients being allowed to, families being allowed to take patients back home is also, the families being allowed to stay inside the ICUs in the wards, none of which was not allowed in the cities, but here the doctors figured that having a family member will help the patient because there's better caretaking and there's better communication and the warmth of having a loved one around them. And this was Suhanu Das. Her husband Anand Das had chronic kidney disorder. He was in the COVID-19 ICU in a critical condition. The doctors suspected that he had mucormycosis, and they took a small sample from his nose. Suhanu, who was watching this, fainted and just fell unconscious. Again, the father of another patient pressing his feet. This is Nabi Khan and his son Parvez Khan. Parvez was playing a prayer, Islamic prayer for Nabi Khan. Nabi Khan also had a lot of complications and he passed away a few days later. This is Mithau Ram, Dr. Shilpa Khanna checking on Mithau Ram just after it was brought in. Mithau Ram, he was brought in a very serious condition. I think the oxygen saturation was around 30. He could walk in, he could get up from his chair and get on his bed. And he was accompanied by his son, who was 17 years old, and he did not look prepared for anything that followed later. That's Mithau's Ram being added to the patients list in the ICU. So the next evening, Mithau's condition worsened. He was unable to breathe, and suddenly all the doctors were around him. They figured that he had a condition in which the air was escaping from his lungs to the chest cavity, which was in turn exerting pressure over the lungs and making breathing very difficult for him. So they figured they had to do a small incision in his chest to let the air out. I was shooting there, and because there was not enough light, and also was putting torchlight. And suddenly, everyone realized that there's no surgical blade, there's no scalpel blade available in the ICU. I just did not know what to make of it. Yes, it's a government hospital, so there was a lot of bureaucracy, a lot of red tape. The calls were being made to other departments, to the ICUs, to other ICUs, to other OTs, everywhere. And honestly, nobody seemed to care that a patient may possibly die because of the lack of a scalpel blade. Thankfully, it was arranged later, but told me a lot about how the system is actually working. Nurses discussing. This was an Asha worker who brought an Adivasi to the hospital for his TB checkups. Another thing that happened during the pandemic was that a lot of other diseases like TB, sickle cell anemia, which is very endemic to the region, they were unable to get themselves assisted or get medicines. So the Asha worker, in fact, I think Asha workers in Chhattisgarh, they are called Mitanans, friends. They went on a strike that day, but this particular Asha worker, she accompanied the patient, brought him to the hospital here, made sure he got the drugs, and took him back home. And these are ventilators at a hospital, which were supplied under PM cares, out of use, just lying in a corner. That's Suhanu again, sharing a bed with her husband. This is interesting that I found. The doctors, while they were during a duty shift, they wrote the prescriptions for the medications for Mithau on the gloves, and also wrote a note for each other, "Miss you." This was another patient who was critically ill. He had hypothermia. His temperature was falling. So his daughter, she filled gloves with hot water and kept them by his side just for some extra warmth. Then I followed a group of teachers who were doing contact tracing in the villages. Here they came to check on someone from their own group who tested positive for the virus. And this is some ASHA workers getting their monthly medicines and pulse oximeters from a PHC in Primnagar. Some 2 months into the 45 days into the pandemic, and they were yet to get pulse oximeters. Earlier in Bamhani, one of the regions under GSS, the ASHA workers, they were given ASHA workers were given pulse oximeters, but the government forgot to give them batteries, to include batteries with the pulse oximeters. So the ASHA workers did not know what to do with the pulse oximeters. And a battery, it only costs about 20 rupees, 2 batteries. But it's a big investment for them because they get paid only about 4,000 rupees a month. And their salaries haven't been paid in a long, long time. From Sarguja, I traveled to a place called Melghat. This is a wedding band that I encountered on the way in Madhya Pradesh. Madhya Pradesh banned all weddings during the pandemic because they wanted to avoid crowding, but this was a wedding that was happening secretly. As soon as I took the picture, people came running. What's happening? Kya galti ho? Kya ho gaya? It's okay. Let's take a picture. And so from there, I traveled to a place called Melghat in Maharashtra. Melghat again is a predominantly Adivasi area. We have the Korku Adivasis here. And Melghat is kind of infamous for its malnourishment levels and how the people here, they don't trust doctors. Firstly, there are not many doctors. So they usually approach faith healers or quacks in the villages. I heard about this hospital that's working in Melghat at a place called Uttavali. So I wanted to see what the situation in Melghat was like. I traveled to Melghat. I went to the government hospital and I met this woman who was just getting discharged. I asked her if I could follow her home, see what she does when she gets back home. She said, yeah, sure. And so, yeah, this is Soldier Chintaram Pilavekar. As soon as she got back home, she took a ritual bath with neem, bale, and tulsi leaves, changed into a new sari, and had dal chawal. Again, interesting because what happened is during the pandemic, there was no public transportation and villages largely are dependent on public transportation. And it doesn't just mean the bus networks or the trains. Trains are rarely available in these parts, but also the auto rickshaws. Auto rickshaws are a very important mode. The 7-seater autos are a very important mode of communication or mode of transport, and villages could not go anywhere. So even if you're sick, even if you're dying, if you're getting an ambulance, great. Otherwise, you just can't go anywhere. So a lot of them, they started approaching quacks in the villages, and Soldier too. She approached a quack. He ran a blood test and told her that she had typhoid. A lot of false positives, by the way, during the pandemic, during the second wave. When her symptoms did not abate, she finally went to the government hospital. She was told that she had COVID. She spent about 2 weeks, most of them on oxygen support, and somehow made it back home. This was something I found the next day. The man on the extreme right, he's a faith healer. And the woman, she claimed, Jamuna More, she claimed he cured her of cancer many years ago, 2 years ago to be precise. She said all government doctors, all allopathy doctors gave up on her. They said she won't live beyond 2 months or so, but she came here, and the godman did some prayers and some pujas, and she recovered completely. So she was here to offer uh, this sacrificial goat and some prayers. This was them walking to a tree where the goat was sacrificed. The feast was given to everyone was in there. So yeah, this hospital that I visited in Melghat is called the Mahan Trust, and the hospital is called the Mahatma Gandhi Tribal Hospital. This is Dr. Ashish Satav. He's about 49, and he's the only senior doctor in about 300 villages in the region. And the nearest big hospital is in Amravati, the district headquarters. But I was told that no one wants to go to Amravati because it's a very risky journey. It's also not a very comfortable journey through the hills. Melghat is a hilly region, and one has to travel down the Ghat road all the way to Amravati. And there's also a widespread belief that anyone who travels to Amravati won't make it back. So nobody wants to go there. So in the end, it fell upon Dr. Satav to treat the 300 COVID patients from about 300 villages. And so Satav, being the only senior doctor at this hospital, there were 2 more junior doctors and a bare minimum nursing staff and nothing else. I think about 8 beds in the COVID ICU, if I'm not wrong. And Dr. Satav he was extremely, extremely careful, always triple masked, had this mask, again, the face guard on him, always had the aprons, and whenever he visited the patient, the plastic sheet would be pulled on them so that there's no aerosol transmission between the patient and the doctor, and so that the doctor doesn't get the virus. One of the villages that I traveled to, Manrega, the employment guarantee work has just started, and I think it was day 1 of Manrega works in the villages. People were returning from work. So everyone suffered, livelihoods suffered badly. And the impact of this was that if someone was sick and they had to travel to a hospital, by then lockdown restrictions eased. And if they had to hire a vehicle to go to the hospital, it costed them at least anywhere between 1,500 to 3,000 rupees, which is a very big amount in these parts. So when people did not have enough work for over a year, many could not even hire a vehicle to go to the hospitals. Many just suffered in the villages. These are women outside PDS, where they get their monthly rations in one of the villages called Chaurakund. A weekly market in Dharni, close to where the hospital is. And anyone who was found not wearing a mask or floating any of the virus guidelines, any of the pandemic guidelines, they were forced to take an RAT test here in the market. This was one night at the hospital. A patient was brought in, Devaram Gurvekar. He's already had the virus, and as soon as he brought in, the doctor on duty, he did not even allow the patient to be brought in because he suspected it could be a case of mucormycosis. So they don't want the hospital systems to get infected with this fungus. So they advised the family to take the patient to Amravati. They said they were taking home. This is a family listening to the doctor. They told me they were taking him to Amravati, but a nurse later told me, I could not verify this, but that they decided to take him home. Next few images, some of you may find them disturbing as a dead person. So just a heads up. The same night, an 18-year-old patient was brought to this hospital. Sunita Bilavekar. She was married for 6 months. I saw a pink truck that was parked in a corner, and I was curious about why the truck was there. I asked someone who was present, he said, "Oh, the patient just died." I followed the family. The one standing in the corner is her husband. And the hospital staff, they did not want to handle the body because they thought it was unnecessary risk for them to handle COVID. Like, they have enough avenues for exposure and they did not want to. It's a dead person anyway, so why risk getting in contact with the patient, was their logic. I asked, I asked him if I could shoot what was happening, and he said yes. And I asked what his wife's name was. I asked what his relation to the patient was, and he said it's his wife. I asked for her name. He didn't know the name, and he later asked his brother, who told me what her name was. So the hospital staff, they gave the family a large plastic sheet and asked them to wrap it themselves. So it's a family wrapping her body. That's her body lying in the pickup truck. Just as the family was about to leave, the police came and they said they could not take the body without the revenue officials being present, just to ensure that COVID protocols are observed while cremating the body. The Tahsildar was not available till the morning, so they moved the body back to the hospital, and the hospital did not have a cold storage, so the body was left in a storage room all evening, all night. They took her in the morning. From here, I traveled to Delhi Rajara in Chhattisgarh. It's a place called Shahid Hospital. Shahid has a very interesting history because Delhi Rajara gets its name from two iron ore mines that are in this town, Delhi and Rajara mines. And these are captive iron ore mines for the Bhilai steel plant. As you can see, it's not very far from here. Sometime in 1979, one of the union leaders, Kusumbai, she died in a hospital run by the Bhilai steel plant because of some pregnancy-related complications. And that's when the workers decided that they were going to build a hospital for themselves. And the hospital is called Shahid because it was named after 11 workers who died in police firing 2 years earlier in 1977. So I was told about how one day in 1982, I believe, 10,000 workers from the mines, they pooled in money, and they all got together on a Sunday, a holiday, and they started building the hospital. They laid the ceiling on one day, 10,000 of them. And they take tremendous amount of pride in being able to run this hospital. They claim it's probably the only hospital in the world which is completely run by workers. Also, Dr. Binayak Sen was one of the first doctors that worked here. And this was on the Maharashtra-Chhattisgarh border, where they were testing people. So this is Shahid Hospital inside one of the wards. So by the time I came to Shahid, it was already the first week of June. The virus numbers were decreasing and lockdown restrictions eased. And that's when I actually got to see the impact that the pandemic had on other diseases. People who could not travel to hospitals because of lockdown restrictions or not having enough money during the pandemic, how they were getting treated, how they started queuing up outside hospitals for getting non-COVID diseases treated. This was Shantaramu Ike. He got his vaccine shot and took alcohol the same day. Apparently, you're not supposed to. And he developed serious respiratory complications, and he was at the OPD to get himself treated. They later diagnosed him with tuberculosis. Again, I found these two men a little far, very far from the hospital. They were waiting. They went to Bhilai to get some tests done. Some ambulance driver gave them a ride up till Delhi Rajara. And from here to their home is about 25 more kilometers. And there was no way for them to get to the village in the middle of the night. So they were just sitting there, flagging, trying to stop every vehicle and asking if they would offer them a ride. Finally, 11:30 in the night, a truck driver stopped and took them home. This is again VK in the hospital ward. His wife was holding a nebulizer for him. This was the girl. I found this really interesting that she was doing her homework in the children's ward at Shahid. This is Kiran Boga. Kiran Boga again is one of those cases. She had meningitis. The family did not want to take her anywhere else but to Shahid because Shahid has a lot of people have a lot of faith in Shahid and the doctors here. Also because they consider the hospital to be their own. Kiran was brought with a case of meningitis. And the family had to wait over 3 weeks to bring her to the hospital because they realized they had a vehicle, but they realized they don't have the money for the fuel. The money was sitting in the bank, the local branch was shut, and the ATM ran out of money. So they had to wait about 2 to 3 weeks just for the ATM to be restocked with cash, and that's how they got here. I don't know what happened to her, but the 10 days that I was there, she was unconscious all the time. This is a portrait of Shankar Buhani Yogi. Shankar Buhani Yogi is a union leader who brought all these workers together. And he was the main person who made Shahid happen. It was his idea. It was his brainchild. This was a patient's relative in the COVID ward. Again, so this is Jaguram Sahu. Jaguram Sahu was a mine worker. He then retired. And most mine workers here, what they do is, as soon as they retire, they come to the hospital and they take up some role. They teach themselves something. They try to make themselves useful at the hospital. Like Jagu, for example, he told me he first learned how to give injections. He then first learned how to write the prescriptions for the patients as the doctor was dictating. Then taught himself how to give injections, and later started assisting in the delivery room. He does everything. He even cleans the washrooms here in the hospital. That's him checking the BP of a patient in the OPD. This was another family that I met, the Vishwakarmas. The wife delivered in a PHC closer home, but there were complications. They could not immediately get an ambulance, so they had to wait for the ambulance. And by the time the ambulance came and they could move the baby to Shahid, the infant was dead. Oh, no, sorry. They brought her to Shahid. They brought the infant to the hospital, and they don't have the money to take her to a bigger hospital in Raipur. So they were trying. They spent about 2 hours trying to raise money, and by then the infant had died. So they took an ambulance back home in the middle of the night. It was raining, and I asked the family if they could follow them. And they said yes. So went along in the ambulance. About a kilometer outside the village, it's called Gidali. The ambulance suddenly stopped, and the elders from the village, they walked towards the ambulance. They did some puja, some rituals, and finally the baby was taken home. That's village elders just looking at the family as they were taking the infant home. That's the infant who passed away. By mid-June, the cases came down drastically, and Shahid closed its COVID ward. These are the last patients who were leaving the COVID ward that morning. The woman was 3 months pregnant, and she refused to join the ward. She refused to be admitted to the ward. I watched as the doctors convinced her and the family. And finally, she got admitted to the ward, and she was good to go in about a week. This is another patient. And finally, the COVID ward was locked, and a fumigator was put in. They fumigated the entire ward. So again, coming back to the faith healers, this was a faith healer that I came across in Delhi, Rajara. Nagmata, who I'm unable to show the video today, but what she does is she blesses the patient, whoever comes to her with any kind of problems, personal, financial, or even health. I was there when a patient, when someone came with just congestion related problems. She just blessed them and gave them some prasad and said, come back in a week, you'll be okay. And also a lot of post-COVID cases that started to come in. This was a person who got his first shot of vaccine, and then he got the virus. And he was convinced that it was a vaccine that gave him the virus, and I asked if he would consider getting the second shot, and he was like, no way. I'm not getting the second shot. This was another person that I met. Had a serious case of COVID, recovered, and came back with lots of post-COVID symptoms, including breathlessness, nightmares, heaviness in the chest. I think this was my last day at Shahid, where when the nurses, they put on black patches, there was a nationwide thing going where all the medical staff, personnel across the country, they were protesting attacks against doctors and nurses in COVID wards. So they had a black band protest. Akhwin, do we have more time, or are we good? 45 minutes?
Yeah, we have time. You can go ahead.
I think, anyways, okay, I think we can start taking questions if anyone has.
Thank you, Harsha. These are some really hard-hitting photojournalistic work, and we are so glad that you could do this work braving the pandemic. Before going to the questions, there are a few comments posted by some of the viewers. So Aslam Sai says, "Thank you, Harsha, for doing this project." Hari says, "Really stellar journalism." There are a few other comments, but since we don't have much time, I would like to rush to the questions. So for the first question, which has come, is like, you have done various projects And how tough was this one for you?
This was really tough because, I mean, I've seen a lot of death. I worked in farmer suicides and I covered some bomb blasts, accidents, a lot of things. But especially the time in the ICU was really tough because I spent about a week there. Every day I was going to the ICU. I was talking to the people. I knew that their names, where they came from, all their family members. I was trying to comfort them. And suddenly, like, you come back one morning and the patient's bed is empty.
Mm.
And you realize the patient passed away the previous night. Like Mithavuram's death, it really affected me because the son, he did not tell his family, his mom and two sisters, that his father's condition was really serious. And Mithav, I spent a lot of time talking to his son. I even hugged him once. Shouldn't have in a COVID ward, but just couldn't help it. So knowing all these people, pretty much everyone I photographed in the ICU passed away. Nabi Khan, whose son was seen holding a mobile phone, he passed away. Suhanu Das, who fainted, her husband passed away.
Mm.
So emotionally, it was really tough.
Right. Yeah. So, continuing with that, we have another question from Hari. Hari asks, Harsha, how do you reconcile with all the trauma you hear and witness when someone works like you do with detail-oriented reporting? You end up getting very invested in the people you meet, actually.
I just talk to my friends. And that really helps. A few journalist friends or other friends that I talk to, and talking to them really helps each time.
All right. So another question from Gopal is, did you face challenges communicating with people? What was the personal learnings on being with people during such difficult times?
But there was no communication challenge as such because Chhattisgarh, everyone spoke Hindi.
Mm.
And I thought there would be some problem with the Kurkus in Melghat, but turns out Melghat is really close to Madhya Pradesh. Okay. And all of them spoke Hindi. So there was no challenge at all. Mm. What was the second part of the question?
What was your personal learnings on being with people during such difficult times?
Personal learnings, I don't know, maybe. I think I just want to work more on public health now. Mm.
All right, yeah. So I have another question which asks, how could you travel in such restricted times?
So yes, I just rode my bike. I figured public transportation would be a problem. Flights or cabs or buses couldn't be relied upon. And because Chhattisgarh especially was, they were changing their travel restrictions every day. And I don't want to be stuck in any place if they suddenly decided to shut all kinds of public transportation. So I just rode a bike. Mm-hmm. I traveled for about 42 days. Was that on a bike?
So another question is like, how is the condition of these villages and people you have photographed currently? How are they right now?
Condition of the villages and
the people you have photographed.
I think most of them are fine. Those, especially in the case of JSS, the village health workers did such a tremendous job. Most of them recovered. They went back home, and all the COVID wards I hear now are shut. Mm-hmm. Our cases have come down.
So Priyanka have another question. Harsha, what's the element of red tape in your presence at these places? I'm guessing your camera can't be hidden in a pocket.
No, there was no red tape as such. The only place where I had a problem was in Ambikapur, because it was a government hospital. So what happened was the first hospital, JSS, I called the main doctor, Dr. Raman Kataria. I explained what I was doing and asked if I could come. And he said yes. It really helped that by then I recovered from the virus. I just recovered from the virus. So even the doctors were less hesitant to let me into the COVID wards. So I first went to JSS, and from there, when I went to Ambikapur, the hospital was not very keen on letting me into the ICU. Being a government hospital, they were really worried about this journalist walking in, taking some pictures, or something that's not right in the hospital and giving them trouble. Yeah, so I had to pull some strings there, call some friends who had contacts in the district administration, and they made a few calls. So I finally got access. Anyway, I don't think I had a problem anywhere else.
Okay. Cool. So we have another question from Nalini, which says, were there any deaths due to the lack of oxygen in the second wave in these areas?
Thankfully, no. Firstly, because there were not as many cases as compared to concentrated like in the cities. So there were independent oxygen suppliers who could cater to these hospitals.
Right. So another question by Yashovardhan asks, like, what is the secret of you about interacting and connecting with people while you photograph?
Is there a secret? You just be nice to them, talk to them, ask their names.
Right. Cool. So this question is basically from you as a photographer. How do you choose your projects? Several of the projects you have done are already done by various other photographers like the agrarian crisis or even the COVID work. How do you make a difference with your work?
I think a lot of my work is based in rural India. So, and I always look for a connecting thread between various issues that I photograph. And while working on one story, it leads to something else. And there's no, how do I choose my stories? It's hard to explain. I just feel a connection with the story. I think, okay, let me put it this way. I want to learn about something. I read up, I learn about an issue, and I try to read up a lot more about it. And when I feel that there's not enough material that is available out there, or someone, very few people have worked on this issue, or there is not enough coverage of this issue, I try and see if I could go there and work on it.
So the next question is like, why did you choose photojournalism as your career? And there's another one attached to that, your advice for anyone who want to pursue photojournalism as a career.
Photojournalism as a career, I think it's over in India. I had the luxury of being able to work for 20, 30 publications a year when I started out. And this wasn't very long ago. But right now, I think it's very hard to make a living as a photojournalist. If not for the support of this grant from National Geographic, I don't think I would have been able to go on this trip for 42 days. I went on my bike and petrol was at what, Madhya Pradesh, it was 104 rupees. Some 5,000 kilometers on the bike. There was no way I could have afforded a few rupees. Or more importantly, there's no publications that pay photojournalists well enough for their work. So when I started out, there were quite a few avenues, a few magazines and newspapers that paid for photojournalism. I don't see that happening anymore. A lot of us, what we do is we rely on grants or do commercial work or any other work that pays and kind of subsidize photojournalism for these publications.
So do you have any advice?
Advice, if you're starting out, I would say just find a story that's close to you, not just emotionally, but also geographically. You don't want to travel a lot. It's easy for someone to, it's always very exciting to be able to work in a place like a remote place like Ladakh or Northeast or wherever. Mm-hmm. But when you're starting out, it's better to be able to find, it's great if you're able to find a story that's really close to where you live.
Right.
Because that way you'll be able to make many more trips, you'll be able to spend much more time. You don't end up spending a lot of money on it. Mm-hmm. And when you spend a lot of time, you obviously get a lot of depth in your work.
Right.
And editors always recognize and they really value the depth and the emotional connect with the work. Mm-hmm. And that could lead you to other assignments.
Right. So Rohit, I have a question. Hi Harsha, I was waiting for this talk. Thanks. I just wanted to ask, how did you research about the places to document or photograph? And were these hospitals in isolated or not concentrated areas?
The starting point was JSS in Ganyari because I read a story about this long ago in Fountain Ink. Mm-hmm. It stayed in the back of my mind. And when I wanted to work on something around the pandemic, I started thinking about ways to do this story. And the first thought that came to me was all these idealist doctors we hear about that charge 10 rupees, 50 rupees for a consultation or don't charge anything from the poor. I was thinking on those lines and suddenly I remembered this story. So I reached out to a few people, asked if there are more hospitals like this one. I made a list, but I was totally playing it by the ear. I had a list of 4 hospitals when I started out, but 2 other hospitals I did not visit, but Ambikapur and Melghat, there were 2 hospitals that were not originally on the list, but I thought they were really interesting and I decided to go there. So it's just get to one place, people understand what you're trying to do and they put you in touch with other people or they tell you about other places that are doing similar work. I think I now had a list of at least 20 hospitals like this across India.
Mm-hmm. Yeah, that's great. So Sanjay, I have a similar question which I've already asked and you've answered. It's like, how does one deal with the stress and anxiety that comes while document a project like this? So Sanjay, Harsha has already answered this. You can just look back in our YouTube or Facebook video. There's another question. Is there a photojournalist whose work during and about the pandemic, especially rural healthcare, you look up to? This is asked by Priyanka.
Rural healthcare, I don't know. But there are a lot of photographers that did tremendous amount of work. Danish Siddiqui, of course, Ishan Tankha, and who else? Certainly can't remember names. I think Vijay Pandey was also out there. He was shooting. A lot of photographers and a lot of wire photographers, news photographers that took a lot of risk and documented the crisis. Had it not been for them, we would have never known about the gravity in places like Delhi, firstly. Yeah. I think those visuals from Delhi, uh, they made the rest of the country sit up and notice what's happening with the second wave,
True.
how the government is mishandling the crisis.
Cool. Harsha, do I have the last question for tonight for you? Do you think images can make an impact or change the world? And do you take images with this thought in mind?
Um, Not really. I think only a very small fraction of the images that we take end up making any impact. But just we should, because we hope that we're able to make some difference with our images. Like if I'm taking 100 images for a project, if I'm meeting 100 people for a project, the hope that a photo of at least one person will be able to make a difference for it.
Right.
The work will make the difference, make a difference to the life of at least one person. That itself is, I think, quite a, yeah.
Yeah, that really serves the purpose of why we photograph. Thank you so much, Harsha, for patiently answering all the questions thrown up to you, and thanks for presenting your wonderful work.
Thank you,
in this
Aquinan. Thank you,
COVID-19
everyone, for
pandemic.
joining me.
Yeah, thank you, everyone, for tuning into this artist talk with Harsha. You can look up for this talk in our YouTube and Facebook channel, and also all the previous talks which was happening as part of the artist talk series at the 7th edition of the Indian Photo Festival. So we have more interesting talks coming up. So we request all of you. All the talks are at 8 o'clock in the evening. So we all look forward to see you for tomorrow night's talk. Till then, have a good night. Stay safe.
Bye.